Clubfoot is one of the most common foot problems that babies can be born with, and approximately 1 in 1,000 babies in the UK are born with clubfoot. Clubfoot's also known as talipes. I think the historical vision of clubfoot is something of the past, and no longer do we think about children in calipers or with limps. In the past, children who'd been treated with surgery to correct their clubfoot could be left with stiff, painful feet that severely limited their activity.
We were diagnosed in the 22-week scan, and we thought that she was facing years of surgery and scar tissue and arthritis and everything, and it just hasn't been like that at all.
This is a skeleton model of a clubfoot, and you can see that the foot is turned in and round, and also at the back of the foot the heel is lifted up and high, held there by very tight tendons at the back of the foot and tight tendons on the inside here. The foot is also short, and it's also rather wide in shape.
The birth was great because we knew about the talipes and were expecting them, and it was a planned caesarean for her, and so when she came out with wonky feet, we were expecting them, so there was no shock.
The good news to families whose baby has just been diagnosed with clubfoot is that the Ponseti Method offers a simple and straightforward method of correcting clubfoot which involves minimal surgical intervention. In an ideal world, the baby would begin treatment at about 2 weeks of age. Ponseti Method involves careful assessment of the foot, followed by manipulation of the foot, and this is a very gentle movement through the available range.
I think it's about 130 degrees that they have to rotate it. So they rotate the foot to a position that's not uncomfortable for the child, but which is challenging the tendons and things. And so the child's not in any kind of pain or anything, and then they simply cast with the foot in that position.
The final piece in the jigsaw is to release the tight Achilles tendon, which allows the heel to drop down into position, and this can usually be done under local anaesthetic. The foot then goes into a final cast which will stay on for 3 weeks while the tenotomy site heals. Usually babies take approximately 6 casts to get a corrected foot position.
I remember a parent at the time saying, "Oh, this stage goes so quickly, you know, you'll look back on it and it will have gone in a flash." But at the time it's really real for you, and you think, how can it possibly go quickly? But then it's 6 weeks and it's nothing, and then you're on to the bar and boot stage.
The boots and bar are a vital part of the treatment and continue to hold the foot in the corrected position and allow the bones to remodel. The boots and bar are worn for 23 hours a day for the first 3 months after correction, and then at night times and naps until the child is 5 years of age.
It's almost like starting a counter, and you've got this hour out to bathe her and play with her, and then give her a kickabout, and then put her back into the boots.
But that was fine. She never complained that they went back on.
No, she didn't.
Which is an advantage of the treatment starting so young.
Yeah.
She learnt to crawl wearing them. She would learn to roll over first and then flick her legs around, and she just learnt to do that. She wasn't slowed down by them. And in fact, I think she crawled at about the right time,
yes,
sort of 9
yeah.
months.
Mm-hmm.
And she started walking, I think, at 13 or 14 months. So pretty much the same as any other child.
It is a simple method of treatment, but it does rely on the clinician being very precise about their technique. It also relies on positive input from the families and commitment to see the process right the way through.
When we were first told, you know, you have all these terrible thoughts going through your mind, but she's just like any other normal two-year-old running around. And it's just amazing. It takes your breath away, doesn't it, really?
To us, it was tragic. But, you know, it's not so bad. And the treatments for it these days are so good that, well, count our lucky stars, really, that's all she had.